Hello! Hello, I'm Taj, and this is a video on therapeutic communication. In this video, we're going to show two examples, one of therapeutic communication and one of non-therapeutic communication. There is also going to be some wound care involved.
Hi, my name is Ronald. I'll be the sick patient with wound on the left arm. That's it.
My name is Kim. I will be playing the part of the therapeutic nurse. And at the end of the video, we will be having a discussion and we'll be getting your feedback on what you thought about therapeutic and non-therapeutic communication and how it affects the delivery of care.
Oh, this hurts so much. When is this nurse coming? Oh, I'm sorry. Now speaking?
Hi, Mr. Galon. It's Taj from Community.
Hi. Hi, how are you?
Good, how are you?
Not too bad, but my left arm is really sore right now, and I think I need a dressing change. Yeah. When do you think you're coming?
I'm going to be there in 5 minutes. Okay, bye. Hi. How's it going?
Oh, my left arm is really sore right now.
Mm-hmm.
Yeah, I think it's swollen too,
Okay.
and I need a dressing change.
Alright, let's have a look.
Okay, be careful, okay? 'Cause this one hurts so much.
Okay.
So what do you think?
That's fine.
Are you sure?
Has a
So what you
little
gonna do now?
pungent odor there, but well, we're just gonna change the dressing now.
Okay.
Yeah.
You're not gonna call the doctor about this?
I don't know. I'll see. I
Okay.
mean, that looks okay, but we'll see how it goes.
So how long have you been doing this?
Too long.
How long?
2 years or so.
Okay. So you must be really good at it.
Yeah, I'm alright, I guess. So what happened?
No, I fell on the stairs.
Oh,
And then like
sucks.
20 steps, and then I end up with this. And I have RF, like open reduction internal fixation of my left arm.
Mm-hmm.
So I was in VGH for a couple of weeks, like 4 weeks.
Yeah,
Yeah.
awful hospital.
Is it? I had good nurses though.
Okay.
Yeah. Okay.
Alright, let's have a look.
Okay, be gentle, okay?
Alright, I guess. Okay, stay still.
Okay. Be careful.
Relax, Mr. Gayon. It's fine.
Okay.
Should have told me you were in pain earlier. Could have given
yeah.
you something for it.
Yeah. Well, it was so painful a while ago, but it's bearable now.
Okay. It's a little bit pungent.
Okay.
I think we may have left it too long.
So, do you think is there any infection there?
Yeah, it's a little bit red. I
Okay.
think there's infection in there.
All right. So, what you gonna do next then?
Well, I suggest that next time you probably should let us know once it starts to get a little bit more,
Okay.
odorous. Got lots to do, lots of patients to see.
All right.
Alrighty, well, I think we're done here. Have a good one. See you later.
Okay.
Bye.
Now speaking.
Oh, hi. It's Kimberly calling from Langara Community Health. I was wondering if I could speak with Ronel.
Speaking? Sure, yeah. Are you coming here to change to do my dressing change?
Actually, I'm just calling to follow up. You've been referred by VGH because you just had an ORIF. So I'm one of the nurses in the community, and we do home visits to make sure that your wound is healing well and that there's no signs of infection.
Whenever you're free, I'm just gonna be here at home, so I won't be going anywhere. So you can come anytime and you can give me a shout.
Thursday morning be a good time for me to come?
Yeah, that's fine. What time?
I would be coming around between 8 and 9.
8 and 9. Okay, that's fine.
Alright, so what I'll be doing is I'll be changing your dressing. You might, it might be a good idea to take some pain medication prior to the appointment, just because you might feel some discomfort during the dressing change.
Okay, thanks for reminding me. Okay. Sounds good. See you then. Okay, bye. Hi.
I'm Kim from the community health.
Hi.
Are you Ronel?
Yeah, I am.
Nice to meet you,
Nice
Ronel.
to
My
meet you.
name is
Okay.
Kim. I'm the
Come on in.
community health nurse.
Okay, great.
So from our last conversation on the phone,
Yeah.
I've spoken to you about taking some pain medication.
Yeah.
Have you?
I already took it 30 minutes prior.
Alright,
Yeah.
that's good. So how's your arm feeling?
It's sore right now and it's a little bit swollen too, yeah.
Sore?
Yeah.
Alright, so
and
what
I cannot move, it's hard. So I think you have to be very careful when you're doing your dressing
Okay, I'll
change.
try to be very gentle. You have to expect that you might feel some discomfort during
Yeah,
the dressing change. Alright, so let me just take your arm off the sling.
Okay, yeah.
So I'll just rest it on the.
Okay. So be so gentle, okay?
So do you experience any increased pain over the last few days?
Yeah,
And have you been on top of your medication?
yeah. I take the allotted 2 milligrams as needed.
Okay, and do you have any problems with taking the medication? Do you feel any side effects?
No, I think I'm okay. Yeah, I think I'm okay.
And how are you coping at home? Do you have any trouble
Well,
doing any housework?
yeah, for sure. Like again, it's hard for me to go get do my groceries for sure.
Yeah.
And yeah, there's still a lot of drainage coming out from this wound though. But I'm afraid it might be infected. Or...
Alright, so let me have a look. I'll
Okay.
just put this under
Alright, there you go.
me. I'm just gonna clean it with some saline solution.
Okay.
Alright. So I'm looking at it. It
Yeah.
doesn't look like there's any increased redness around the area.
Yeah.
So that's a good sign. That
Okay.
means there's no infection. I don't see a lot of drainage.
Yeah. How about the yellow stops around it? Some yellow stuff I can see.
As long as it's very minimal, it
Okay.
shouldn't be
Okay.
of concern. There are different kinds of drainage that you'd expect from a wound.
Okay.
So it's not, if it's greenish, I would
Yeah.
be concerned.
Yeah.
But right now, it looks like your wound is healing very well.
Okay.
And the staples are intact. That will be removed in a few days.
Okay.
Right. Do you have any concerns?
I think we're okay. Thanks a lot for explaining though. I appreciate that.
So we finished the dressing
Okay.
change. Do you have any questions for me? Any concerns?
I think I'm good. I just have to call the community health for any questions.
Alright, yeah.
Okay.
And if you have any increased pain or if you see that your dressing is leaking, don't hesitate to phone us. And